All right, I'm here today with Patti Gurney, pediatric nurse practitioner in primary care. She is the immediate past president of the California Association for Nurse Practitioners, the organization representing the interests of over 36,000 NPs practicing in the state. She has been a champion of increasing access to healthcare. She led the organization through crucial legislative progress in the last few years, especially as Assembly Bill 890 became law. This allowed a path for nurse practitioners to transition to independent practice in California. As a recent chapter president of the organization myself, I'm very proud of the achievements of CNP, especially under Patti's recent leadership. Welcome, Patti.
Thank you very much.
All right. Patti, what unique qualities do nurse practitioners bring to the healthcare system?
Well, the most important thing is that nurse part of the title. First and foremost, we're nurses, which means that as in our training, the basis of everything that we do is our patients. We have learned how to assess our patients by what they say, by the expressions on their faces, by those vital signs, by what our hands and our senses tell us what it is that that patient needs. So then as nurse practitioners, using those tools of medicine, diagnosis, and then we can be able to figure out what it is that they need to treat whatever condition it is that presents itself.
Why did you get involved in the California Association for Nurse Practitioners? And what do you see as the main purposes of having such a professional organizations dedicated to nurse practitioner practice?
I was very fortunate during my training to um, get from the very start how important that professional advocacy role is, and to understand that as a nurse practitioner, I was entering a space and a place as a professional. In other words, not as an employee so much anymore, no matter how or where my paycheck was to come from, but as someone who was able to determine and make decisions about how I practiced and where I practiced, including all of the values around that. My values about people and caring for people and serving others. And a huge part of that then is that care for the profession. I understood very early on that it was only in connecting with other nurse practitioners, to learn from them, to hear about their practices, to share my struggles, and get encouragement, that that was the only way that I would be able to learn and grow, and actually thrive in my profession. So it was very important to me from early on to be involved in my professional organization. I trained in the early 90s here in California. We moved for a time because of my husband's studies to Virginia. In Virginia, I was also very involved in my professional organizations. And through that experience, and I did have some leadership there in that capacity also. When we moved back to California in 2000, one of the first things that I did was to join the then California Coalition of Nurse Practitioners. That we changed our name, I want to say in maybe 2004, to CANP. So just that piece of learning from other nurse practitioners, being encouraged by other nurse practitioners, and understanding that my practice, in order to be what it was that I trained for, could only happen in within whatever framework was available to me in my state. And that certainly starts with the legislative underpinnings of what it is that we can do. So it doesn't matter how much training you have, it doesn't matter what skills you have. If your legal system doesn't license you to perform in that way, it doesn't matter. So that's why it's always been very important for me to be a part of making sure that those legislative changes happened in order to enable us to practice to the to the top of our license. We're still getting there, but man, we've gotten much farther than I dreamed that we could at this point.
The California Association for Nurse Practitioners has worked in some capacity since 1977 to create a good legal framework for our NP practice here in California. The initial achievements including things like the right to prescribe medications. More recently, the focus has been on the ability for NPs to transition to independent practice in certain appropriate settings as a way of increasing access to care. In your experience with CNP, what strategies and talking points have been successful in gaining political support to strengthen the NP profession in the state? In other words, what has helped politicians, the public, healthcare organizations see the value and the need for strong NP practice? How did we get here?
Well, it's been a long, hard road. I would say that the attempt to get any form of independent practice has been one that has been a goal from the beginning of the formation of our professional organization. What really enabled the current legislation to take hold and then become successful was just the reality of the healthcare situation that we find ourselves in, where we have an overabundance of patients needing care and a true and increasingly dire shortage of physicians to take care of those patients. And we're definitely seeing the terrible ramifications of that situation. At the same time, because nurse practitioners have been in practice for over 50 years now, then our profession has grown over those years. We have many, many studies that have shown safety and efficacy of our practice and our ability to meet those gaps in healthcare. And so the current champion, Assembly Member Jim Wood, he comes from a rural district who saw firsthand in his district the dire consequences of the lack of primary care, and particularly primary care physicians, and how people were really going without vital health care, and how the nurse practitioners who were working in his district were doing a wonderful job. So that healthcare need, combined with the data that we have, a very strong set of consistent data showing safety and efficacy and quality, those two things then finally made it possible. And then the third thing that happened in the middle of that was the pandemic. So with the pandemic, all of those simmering health problems really came to the forefront and became reality to anyone who had eyes to see, and certainly our politicians saw firsthand the need. And those who asked even the first questions really saw how nurse practitioners were a huge part of the professionals who stepped up to take care of people suffering in the pandemic. So I would say those three factors then really made created the framework and the environment able to overcome the then very, very an ongoing, very powerful opposition. So those three things in combination.
It's been interesting to see some new coalitions and collaborating partners also emerge in this process. CNP has worked very actively, from what I've seen, to find partners who share our goals and who see NPs as part of the solution.
So absolutely, and that would be the other major contributor to success was the broad and very, very large coalition of healthcare providers and underpinnings from long-term care to the hospital association. I mean, we had one of the union providers, SPLC, very large, broad coalition of healthcare partners who joined with us and advocated on our behalf to make this change, because they are really suffering and are unable to meet the needs of their patients that they serve. So yes, absolutely. All of those partners were absolutely key.
Patti, why is it important for nurse practitioners to get involved in building and promoting their profession?
Well, nobody knows our practice like we do. And so if we don't speak for ourselves, then others will speak for us, about us, and perhaps erroneously about us. So it's very, very important that we always be ready to speak about and on behalf of our profession.
What are you most proud of from your years of leadership in the California Association for Nurse Practitioners, especially your recent presidency?
I think the thing that I'm most proud of is how I witnessed firsthand how my nurse practitioner colleagues just stepped up so spectacularly to meet the dire needs that presented themselves during the pandemic. And I would say that your practice in particular is probably one of the main examples when I think about those days. So being able to be in a position where I could see the large picture, see like the overview, in addition to being able to be on the boots or on the ground during that time of such fear and uncertainty, was a tremendous, as difficult as those years as it was. My presidency was definitely a pandemic presidency. It was 2020, July 2020 through June 30, 2022. So absolutely during the years of the pandemic, we did not have an in-person board meeting until our very last one in March of 2022. So in spite of all of those challenges, I am so proud of how my colleagues, how I was able to witness nurse practitioners really step up and just show everyone the truth of what we've been saying all along, that nurse practitioners provide very high quality, safe, compassionate care. And we really do need to make sure that we're able to provide that care without restriction.
Thanks, Patti. It was very interesting to see how the pandemic opened doors for our NP practice at UC Davis Health, where we helped out our internal medicine colleagues by building a new NP team and PA team during the pandemic in our hospitalist division, which has grown now into a large successful program, but it certainly came out of that dire need.
Right.
We're now adding teams and adding providers and providing 24-hour high quality care for our hospitalized patients. So it's been very exciting.
Yeah.
All right. Thank you, Patti, for joining me today to give us some of your insights as president of CNP. Thank you.
It's been my pleasure. Thank you so much.